I am Dr. Sankaranarayanan. I am a senior medical advisor at the Research Triangle Institute International in New Delhi. I also continue as a senior visiting scientist at the International Agency for Research on Cancer of the World Health Organization in Lyon in France, where I was working as the head of the Cancer Early Detection and Prevention Department for several years. Cancer is not one disease, it is multiple diseases. Each cancer requires a different type of intervention, whether it is prevention, early detection, treatment, or follow-up care. In order to encompass the complexities of cancer management, the World Health Organization several decades ago formulated a plan called the National Cancer Control Plan and encouraged all member states to constitute a time-bound action plan in the name of National Cancer Control Plan, linked with budgetary lines. And in fact, India was one of the earliest countries to formulate a National Cancer Control Plan and encouraged each individual state to formulate their own state cancer control plan in a time-bound action. And in fact, Kerala was one of the earliest states to implement a state cancer control plan. The first plan was called a 10-year action plan, which specifically mentioned in a time scale what services they will develop. So the National Cancer Control Plans is a written document where all elements of cancer control, namely prevention, what preventive interventions will be implemented, what early detection interventions will be implemented, how the cancer diagnosis and treatment services will be provided, how many cancer centers will be constructed over time where people can access for diagnosis and treatment, and how the follow-up care will be provided both within cancer hospitals as well as in extension clinics, so that people who have been already treated and surviving well need not travel long distances for follow-up care. And for those people, unfortunately, having a very advanced disease, how the symptoms of cancer can be controlled with palliative care. So all this put together is a National Cancer Control Plan. In recent years, the focus changed to non-communicable diseases in general, via cancer, cardiovascular disease, diabetes, and respiratory illness were all clubbed together to formulate what is called as an integrated non-communicable disease control plan. This plan involved certain additional investments for cancer, but on the other hand, given the complexities of cancer, how the different interventions have to be provided for different cancers, I think this plan lacked a certain focus on cancer control. For this reason, in addition to the non-communicable disease control plans, national cancer control plans are being revived again. So in summary, formulating a national cancer control plan with a time-bound action and linking with the budgetary resources is the way to move forward and progress in formulating and implementing cancer control in action in the real world. Cancer is an expensive disease to treat. And in fact, the dictum in low and middle income countries like India always has been out-of-pocket payment for treatment services. So given the fact that cancer requires a lot of resources for diagnosis and treatment, this out-of-pocket payment made many families bankrupt. And in fact, people have to sell many of their properties and cattle and whatnot to cater availing cancer services. So from that perspective, introducing universal healthcare access has been a major policy of the governments, where it essentially means that you avoid or significantly reduce out-of-pocket payment for diagnosis and treatment of illness. In India, even though some of the state governments have introduced insurance schemes to cater to the needs of people belonging to the lower socioeconomic strata, it was not a uniform policy across the country. I think for the first time, the government of India has come out with an action plan in the form of Ayushman Bharat, where a huge proportion of the Indian population will be covered by this particular scheme, which will support to a large extent the diagnosis and treatment needs of major illnesses like cancer. But Ayushman Bharat is a cost reimbursement scheme. It is the first step towards universal health care. If you go to Thailand, universal health care exists. There is no out-of-pocket payment for any illness. A Thai citizen can travel through the health services seamlessly for any healthcare needs. Ayushman Bharat will be the first step towards that particular endpoint of ultimately bringing in universal healthcare in India. It works by empaneling a group of both public and private hospitals into the scheme where the eligible people can avail services. But there is a word of caution. There is a limit to which these programs will support treatment and diagnostic costs. So it is very important on the part of the empaneled hospitals to provide services in an equitable and accessible fashion so that whatever resources which are provided by Ayushman Bharat are effectively used to completely treat patients. And this is very important for cancer because half-baked treatments are not effective. They are simply waste of resources. If cancer has to be tackled, it has to be detected in very early stages and treatment has to be provided in its complete nature so that the disease can be ultimately cured. So unless this happens, the cancer control cannot be realistically achieved. So careful utilization of the facilities and the financing services provided by the Ayushman Bharat by the empaneled hospitals in providing care is a vital element to ensure its success in achieving the objectives for which it has been organized. Investing in public health services, particularly the infrastructure, is a very important component in healthcare. Without adequate infrastructure, you cannot diagnose, you cannot prevent and manage diseases. But having a healthcare infrastructure is one thing, but having enough number of skilled people to operate through the infrastructure to provide the services is another thing. Even in the presence of an adequate infrastructure, if human resources are not there, the services will be very inefficient. So that means one need to have a systematic plan to generate human resources in all aspects of healthcare. And if you take cancer, in the case of cancer, we need to produce oncologists in different disciplines: surgical oncology, radiation oncology, medical oncology, pediatric oncology, cancer nursing, biochemists, radiation physicists, technicians who will operate radiotherapy equipment, scanners, and technicians who will be running the laboratory services, pathologists, pathology technicians. So there are so many requirements of human resources, and it is a time-consuming action. So that means the planning has to be quite advanced, quite early, so that you eventually end up having sufficient number of human resources to man the health services. So this is an important aspect in the implementation, the planning and implementation of cancer control services.